Let's bring in Caitlin Conant and Ed O'Keefe. Caitlin is our CBS News political director, and Ed is our CBS News political correspondent. A lot to get to. A lot was covered in that briefing. Ed, let me start with you. The administration announced $11 billion would go to the states and territories for testing. Do we have any sense, Ed, of how that money and when that money will actually be allocated?
Our understanding is at least the supplies have begun to get distributed to the states with a hope that they will put an emphasis on long-term care facilities and nursing homes. The money itself, it was less clear, but it's expected to be in the coming days, next week or so. Look, the states have been asking for this. They need the assistance to pay for testing, to pay for the equipment that is needed to conduct the tests. There's concern that Medicaid may not be able to help some people that may, for whatever reason, need that program's assistance. So this is a pretty significant attempt now to help pay for that. I think a lot of people will be asking, why now? What took so long? It was quite strange to see the president continue to brag there that we have, the best testing capabilities next to Germany. It's like, yes, but as Weijia was saying there at the end, why are these necessarily factoids to be bragging about? And yet he seemed eager to do that today. But again, significant chunk of change. There were other elements of this discussed with governors earlier today before this announcement here in the Rose Garden. Basically, the administration now hoping that the states will continue to ramp up testing at nursing homes and long-term care facilities, believing that that is really one area of potential outbreak. But generally pleased to see that the numbers overall across the country seem to have leveled off. And there are only a few regions left where about 20% of people that are testing positive, one of them being here in the D.C. area. Minnesota is another. There's concern about a potential outbreak in Minneapolis, according to federal officials who talked to the governors. And the governors in turn said, look, we're trying to do a mix of reopening, phase one reopenings, modest occupancy in our restaurants and stores, but also if the federal government can help us pay for some of this testing and other medical services, we'll take it.
And Ed, just to be clear, was this money from the CARES Act, or was this some new tranche of funding that we're talking about, this $11 billion announced by the president?
That's a good question. I don't know, Elaine. I know that the funding from the CARES Act to businesses continues to trickle out, hundreds of billions there being distributed. But in the case of testing, it wasn't clear to me whether it was coming from CARES. I didn't catch that. My apologies for that.
Well, Caitlin, let me just ask you about this notion of the governors overseeing essentially the testing and the responsibility. It's something that we heard, as Ed just pointed out, this has been sort of a continual theme from the president, where he has very much put that responsibility on the individual governors themselves, even as he continues to talk about the need to reopen.
That's exactly right. And you saw today in Pennsylvania, Governor Wolf was getting into it with some of the people in his state who said they were going to go ahead and get ahead of him and reopen things when he was advising that they phase into it and saying what repercussions there would be. And you see the president today at the briefing was on the opposite side of that, saying he thinks some of the governors are trying to hold back progress and play politics with this. So I think there is this interesting dynamic between the president wanting the states to be able to take the lead and make decisions based on the data that they're seeing and what they think is best based on the cases and the testing and all the health decisions that they have to make. But then he also, which they have telegraphed at the White House for the past couple of weeks, are very eager to get the economy up and running again. And what's kind of ironic about the press conference today is that, this was the fourth day now where we've been talking about who at the White House has coronavirus, was tested for it, who's getting tested, what the health situation is, when they wanted to be talking about the economy. So this has all created a distraction that's muddling their own message as they want to be giving voters and people across the country who want to get back to normal and want to get things going again, they need the confidence to be able to do so. And I would say the past 4 days has been a distraction to trying to get people to feel comfortable doing the things that they were used to doing, going to restaurants, going to the gym, and all of that. So there is going to be this back and forth, I think, between the state level and the federal government.
Right, because the message consistently from public health experts has been that social distancing is the tool that we know is effective right now in the absence of a vaccine, in the absence of a therapeutic that has long-standing research behind it. Ed, let me ask you more about this nursing home testing. So the vice president spoke with governors earlier. We heard President Trump actually get asked during that news conference, why not mandate testing at nursing homes? And it was interesting, the president seemed to be receptive to that idea. But what more can you tell us, Ed, about the recommendations by the administration and the vice president's call?
They're pretty much just that. In fact, one state official I spoke with who was familiar with this call said essentially, great to see the administration finally catching up to this reality, that nursing homes and long-term care facilities have to be tested more rigorously, not only those that live there, but the staff that works at them. In many cases, states have been doing this. Of course, remember, the first major outbreak of COVID-19 in this country happened in February at a nursing home in suburban Seattle, Kirkland, Washington. And so, while there's great relief, it appears, among state officials that the federal government's on top of this now and saying that they should continue to do that. I think someone would turn around and say, well, we have been trying to focus on this. Where have you been? One other note, in terms of this, there was some concern expressed by the governor of New Jersey, Phil Murphy, to the vice president and the administration officials on the call, based on notes I saw, that says, look, there's some issues with hand washing and the ability to do that while we're taking care of nursing home patients. Just given that there may not be readily available sinks necessarily. And there's also some issues with being able to isolate positive patients in nursing homes. Do they necessarily have the rooms to do that? No, they're not hospitals, they're nursing homes. And usually rooms are full of residents. And so that is a concern that they're working through in New Jersey. One factoid that was shared, for example, and just to show you how big a problem this can be, in the Garden State right now, 50% of the fatalities from this disease are among people who live in nursing homes or long-term care facilities. So it remains an acute issue for several states, could become a bigger one in some other states where they haven't necessarily seen big outbreaks just yet. But something certainly that the administration's worried about. They also say, look, meat packing plants, call centers, prisons, places where people are sort of more confined, work together in close quarters, those are areas of concern as well. There's an outbreak that they're monitoring in prisons in Nebraska, for example. So, all of these remain of concern. But nursing homes, obviously, given the population of vulnerable people, the elderly, and the fact that they can't leave those facilities for the most part, is a big reason why they're so worried about it.
Yeah, there have been some really tough stories coming out of New Jersey with respect to nursing homes. Caitlin, let me turn back to you and this notion of trying to strike this delicate balance, if you will, on the one hand, where you have now Vice President Pence's aide being confirmed for COVID-19. You have that valet to the president being confirmed for COVID-19. We heard the president get asked about why not require, everyone to wear masks, including some senior staff who, in that Rose Garden event that we just saw, some of them apparently were not wearing masks. What is the balance here for the president that he is trying to strike as he tries to get the country reopened and get the economy restarted, but at the same time, of course, now has this disease in the West Wing itself?
Right. And again, this is the balance between wanting to keep people healthy and wanting to get the economy back up and running. And our latest poll for CBS News showed that more people wanted to take their time to get the economy back up and running, go back to work if that meant it was going to protect health. And that was the latest in ours. There was a Monmouth poll today that showed that had gone down a bit, where some people were saying, we're kind of ready to get back. And I think a lot of people, are in, as Ed said, this affects elderly people, and I do in large part. And I think there's some confusion in terms of if you can be asymptomatic and you're not getting a test, but your temperature's checked. And I think everything that the White House has been doing over the past few days dealing with this kind of adds to that confusion when they want to be talking about how do we get back to work and get back to work safely.
Right. Ed, Dr. Anthony Fauci is set to testify before the Senate Tuesday. He's expected to do so remotely. What do senators want to hear from him and from other health officials in the administration who are set to testify as well?
Yeah, the FDA Commissioner, Scott Hahn, will be another one. They're all going to testify remotely, is our understanding, and it's the Senate Health Committee, Health, Education, Labor, and Pensions. Lamar Alexander of Tennessee is the lead senator on that committee, and this is essentially billed as a general overview of the ongoing federal response. So it's likely the questions could run the gamut from where's this headed to, how exactly is the NIH and the CDC and the FDA operating right now, what more do they need, or perhaps specific questions about what is going on at each of those agencies as the administration continues to respond. So this has the potential to make great news. This will be one of the more extended or more high-profile appearances by Dr. Fauci in recent weeks. Remember, he has taken on a lesser role at these news briefings that the president's been giving, partly because they haven't been holding them, but also we just haven't seen him as widely over the last 3 weeks or so. And now he, as well as Commissioner Hahn and a few of these other top medical officials, are in some semblance of a quarantine, not necessarily full quarantine, but they decided tomorrow at least that they should testify from a distance, and so they will. But it does, again, have the potential to be newsmaking, and will be interesting to see what, if any, daylight is exposed between people like Dr. Fauci and the president and other top officials who continue to oversee the response, and what are the potential repercussions of that.
Yeah, because Caitlin, it is clear there has been daylight between Dr. Fauci and the president, sometimes at those briefings that were regularly held before the White House coronavirus task briefings, where sometimes Dr. Fauci would clearly contradict the president, who would just be standing, a foot away or so from him. But what position could Tuesday's testimony, Caitlin, leave Dr. Fauci in within the Trump administration?
Well, I don't have a crystal ball, so I don't want to predict too much. But I do think that Dr. Fauci is, a trusted figure. His popularity remains pretty high in polling. And the one thing that's going to be notable, as Ed pointed out, is he's going to be doing it remote. And so that'll just be an interesting image, I think, for everyone. And also the focus will be back on health, because he hasn't been at these briefings, but they also had dialed back the coronavirus task force briefings to, again, re-engage on how do we do step 2 and start opening up the economy. So it'll be a different message, and also just the optics of it will be interesting. And as Ed said, we'll probably make some news.
Caitlin, I also want to ask you about something else that is set to make some news, perhaps. The Supreme Court is set to hear arguments this week in cases involving the president's tax and financial records. And we're going to discuss the legal aspects of these cases a little later in the show. But politically, what is at stake with these cases for the president this week?
Well, for his tax returns, this is something that basically since he decided he was going to run for office in 2015, people on the Democratic side and his Republican competitors, too, have been calling for him to release his tax returns. He hasn't done it yet. So if there's a chance where the Supreme Court says he has to, I think you're going to see the Democrats start calling for them to be released before the general election. And depending on what's in them, which we have not seen them, but it could be fodder for the Democrats heading into the election year.
Well, Ed, I want to turn to the Biden campaign. In an op-ed for the Washington Post, Joe Biden accuses the president of trying to divide Americans. How does this argument play into his overall strategy?
It is essentially the strategy. This op-ed is essentially boilerplate Biden campaign language, critical of the president's response to the pandemic, critical of the president's plans to revive the economy, and critical of the president's leadership overall. That is essentially the message coming from the Biden campaign these days. He would do it differently, of course, but raising concerns. And that whole idea of division, or the fact that the president seems eager to want to do that, divide Democrats and Republicans, suggesting that Republicans are economic freedom fighters while Democrats want the worst for the country, he says, is childish in this op-ed. And it's something you'll see in the advertising. It's something you see in Biden's daily message when he talks to supporters, in his tweets, and something that they believe is working, because after all, he is maintaining a slim lead in the key battleground states, and in national head-to-head polling, there is general concern or disapproval, even if it is just slightly more than approval, of the president's handling of the pandemic overall. So the Biden campaign sees this as one way to at least keep him in the news. We're expected to hear a little more from him tomorrow and throughout the week in various roundtable discussions with supporters. But, the campaign to some extent still struggling to figure out how exactly can he break into the conversation, generate headlines, not necessarily just on the issue of the pandemic, but on the campaign overall. That remains a daily struggle for them as they try to figure out how to campaign in the age of coronavirus.
And Ed, where do things stand with Joe Biden's search for a vice presidential nominee?
It continues. The idea is to keep this as quiet as possible. And so far, at least, if anyone is being vetted, we haven't heard about it. There have been plenty of articles written about the potential contenders. Obviously, he faces still a lot of pressure to pick an African-American woman. And remember, he is going to pick a woman. He has said so, and is said to be picking from about a dozen or so potential picks. It's expected that it won't come this month, that an announcement wouldn't come until June or July, and that's partly because this is a vetting process that usually takes about 6 to 8 weeks. If they only really began their work last week, if part of this work for those that are leading this is a listening tour or conversations with various officials in the party, then they've got to let that start. They've got to recruit all the attorneys that will do this essentially pro bono for them, and then they will begin their research. So at some point soon, we're likely to start hearing about who specifically is among those being vetted, but it's unlikely that those that actually are will be the ones that raise their hand and say, yep, I heard from the Biden campaign, I have submitted my tax returns and everything else they want, and I am ready for this full-blown exam of my life and my background. No, that won't happen. One of the things we are seeing is this idea that some people don't want the job. Well, the moment you start saying you don't want the job and allow articles to get written about it, that's a sign that perhaps you do, and you're just trying to look humble and modest.
Oh, the ways of Washington. All right, Ed O'Keefe, Caitlin Conant, good to see you both. Thanks for your insight. Appreciate it.
Thanks, Elaine.